All right, everybody can say got it, and we'll move on. So good evening, everyone. We're going to get started. First of all, just to begin by acknowledging that we're in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship. We further acknowledge the histories, contributions, and the legacies of African Nova Scotian people who have shared these lands for over 400 years. As people of African descent, we acknowledge our ancestry that is deep-rooted in Africa and the history of slavery and colonialism, which have led many of us to this land. While we express deep gratitude to the indigenous peoples of this land, we invite everyone to work alongside us as we commit to dismantling systemic racism and pledge to honor the dignity and divinity that ultimately connects us all. Sorry. Okay, so this event is being put on by the Nova Scotia Community Alliance, and we welcome you to this evening. We're here to showcase the project. This is a wrap-up event because we are done officially at the end of March. And so we want to, not quite, we want you to relax and have a great time with us this evening. The Nova Scotia Community Alliance really is made up of 4 organizations. The Association of Black Social Workers, African Diaspora Association of the Maritimes, the Canadian HIV/AIDS Black African and Caribbean Network, and the Health Association of African Canadians. So these 4 organizations came together several years ago. You'll hear more about this later on. I'm not going to go into too much here. And we applied to FAC, had funding, and so this project was launched. Now we're at the end of the 5 years, and so we want to showcase the project and share with you what has happened over that time. Next slide. So now we're going to do a little bit of, you've heard a little bit about us, and there's more to come, obviously. We want to hear a little bit about you. So we have 3 questions. They're going to come up one at a time. Just take your time and, respond if you don't mind, please. I'll give you a few minutes to get all the responses in, and then we'll share the results. Okay, so most people are in Halifax. Dartmouth comes next, Preston's, and then Bedford, Sackville. Nobody from outside HR. Okay, let's go to the next, please, Kimberly. Have you engaged with the Alliance before this event? All right. So most of you have, but some of you have not. And so it will be really our pleasure and privilege to tell you about the project for the first time. All right. We'll move on then. So before Kim goes, again, those of you who have come in under the name of Kimberly Berry, if you're here under Kimberly Berry, please put your name in the chat so we can record that you have attended the meeting. And we'll tell you why later on. Okay, Kim.
All right, so good evening, everyone. My name is Kimberly Bernard, and I'm here to have the pleasure this evening to introduce Verena Ritz, who will do a spoken word piece for us this evening. I've had the opportunity to hear Verena at many community events, and I'm always inspired by her words. So I look forward to hearing her tonight as well. Just a little bit about Verena. Verena is a Sudanese Egyptian nurse practitioner, poet, singer, and advocate who uses her art and her clinical practice to provide holistic healthcare. Verena dedicated her master's degree to addressing racial inequities in healthcare. She has created the nurse practitioner role at the federal prisons in Nova Scotia, and she ran the medical and psychiatric clinic at Spring Hill Institution. Currently, Verena works for the Canadian Armed Forces, but is currently on maternity leave following the birth of her daughter. Welcome, Verena, and we look forward to hearing you speak to us this evening through your spoken word.
Thank you so much for having me. This is the first time I've shared poetry.
I'm Laurie.
Since I've given birth.
Do you want to stop sharing?
Oh.
Yeah, great.
There we go. Okay. I'm just going to test the volume of my music here. The baby alarm is also connected to my phone. Hopefully that does not interrupt us. Before I share this piece, I will say this piece is the closest piece that I've written to my heart, and it was written after years of working in acute care medicine, where I mean, Dr. Haas can attest to this, watching several people in their last moments of life. And you see people who leave this world and who hold on to a lot of regret. And over the years, it's taught me so much. And I've had the privilege to learn so much for people who I've been able to care for. And I've learned so much from their families as well. And so I kind of see this piece as my life's mission statement. It's called Intentional. If life has taught me anything, it is to be intentional. Waste not a moment in time, nor a single word that you speak, for apathy is a characteristic of the weak, and you were raised better than such. So if you love someone, let them know how much. Oh my goodness, I'm blanking, sorry. You see, I've never regretted love that I've given, but I have regretted love that I've kept hidden. Open rebuke is better than a love carefully concealed, so swallow your pride and let yourself feel life is too short not to. Be intentional with how you spend your time and what you let consume your mind. What if tomorrow never came? Would you still live up today the same? Or would you make more time for those who love you? Make an extra effort to say thank you. Perhaps you're holding on to bitterness that weighs you down so much that even through your smiles, you frown, it's not worth it. Let go of the conflict regardless of who birthed it. Find your peace so that you may sleep at ease, knowing that you live with intention, knowing that on your deathbed, the only thing worth mention is how hard you work to live without regret. How hard you loved friend, family, and foe, and how easy your love made it to let things go. Be the bigger person and love harder than expected. Love through pain, even if betrayed or rejected. Forgive as you have been forgiven. For we are called to live with intention, to give without need for mention, to forgive even when they are not sorry. And that must be the toughest of all. But know that your Creator sees all. So forgive for you and not just them. If life has taught me anything, it is to be intentional. Waste not a moment in time, nor a single word that you speak, for apathy is a characteristic of the weak, and you were raised better than such. So if you love someone, let them know how much. Thank you. Thank you.
Beautiful.
Thank you
Very much.
much.
Beautiful.
Thank you so much for taking time out of your schedule to be
That's
here.
great, Verena.
Thank you so much. I'm sorry I have to excuse myself.
Yes,
I have
we
another talk
understand.
to attend, but I wish you all the best and thank you for having me.
Thanks for
Alrighty,
joining
be
us.
blessed. Yeah. Okay. We're going to keep going, I guess. Yes, let's keep going. All right. All right. So we're going to introduce you to a couple of key people in the project. So our steering committee, you see Veronica Marsman, who represents ABSW, Lekon Kayode, who represents Adam, Kimberly Bernard, who is the women's facilitator trainer for the project, David Hawes, who is moi, Colin Cameron, who is our financial coordinator, Sam McGill, our project coordinator,
Right.
Kimberly Berry, evaluator, and there you see Laurie Root, who is the other co-chair and represents Shabak. So that's our steering committee. And oh yes, Micah Smith, who is the youth peer educator coordinator, and then Randon, of course, not to forget Randon Wright, who represents CAC on the steering committee. And I want to give a shout out to Randon because he's what we call our social media guru. He has kindly volunteered and given of his time to do postings on social media for the project, and that's been going very well. And there's little snippets of his work that you'll see later on. But anyway, so thank you, Randon, for doing that. We really appreciate it. And next, I think it's the Community Advisory Committee. And so the steering committee does exactly what it says. It steers the project. So overall management of the project is through the steering committee. The Community Advisory Committee, their role really is to advise the steering committee and the project on things that impact the community. So, you know, if we develop a particular piece of work that needs to be, you know, sent to the community, or we have something that we want to do, we ask the Community Advisory Committee to help with that. So let's see them, Laurie. So there's Angela Harper, and Angela is one of the members. There's Tyro Setlong. There is Delroy Hill. And there's Reverend Joyce Ross. There's Randon again. And there's Karen DeMay. So again, big thank you, big shout out to CAC for the work that they've done for us over the last 5 years. Thank you. Okay.
So I'm up next, and I just wanted to go over a brief history of how we started the project and the reasons why we started the project. So in 2016, the Public Health Agency of Canada launched a new community funding program for HIV, hepatitis C, and sexually transmitted and bloodborne pathogens it was called the Community Action Fund. The major change to the FAC funding programs that was advantageous for the ACB communities was because FAC had broadened their eligibility to a larger number of communities, organizations, including the African, Caribbean, Black community. In the previous funding programs, the invitation was generally limited to HIV, AIDS, and Hep C organizations. So that was crucial to us applying for that money when we learned that it was opened up to other organizations. So this was really the first opportunity for many African Caribbean organizations in Halifax, Nova Scotia, and Canada to apply for this particular federal funding. to develop their own culturally relevant, inclusive STBBI interventions. So Hawk, Adam, and ABSW and Shabak decided to form this alliance and submit a proposal to FAC. And to our surprise, our proposal was accepted, and it was a 5-year project, which we all know it ends at the end of this month. But until this time, there had just been 2 other ACB specific initiatives focused on HIV that were funded by the public or by other funds. And one of them was the Black Outreach Project, but that was in 1992. And the second one was the Nova Scotia AIDS HIV Black Communities Initiative by African Nova Scotian, which was in 2006. So these 2 projects actually informed us because it did identify gaps, and those gaps still existed in 2016. So not to our surprise at all either. So the need for the ACB specific approaches to HIV, hepatitis C, and STBBIs interventions was in response also to this growing research, this evidence that was showing up, that individuals who identify as Black are overrepresented in HIV positive case reports. According to the 2017 surveillance report, Blacks represented 25.3% of the reported HIV positive cases in Canada, yet only represented 3.5% of the Canadian population in 2016, according to the Canadian Census. In addition, Black women represented 46.3% of the reported cases among females. This overrepresentation of Blacks in the HIV epidemic in Canada was alarming, and it required a concerted effort to provide culturally relevant education to reduce stigma and to help prevent the spread of infection in Black communities. So the purpose of this project was to respond to those alarming numbers and to lead, develop, and facilitate culturally relevant educational workshops on the prevention of HIV,
Yes.
hepatitis C,
Oh,
and
okay.
STDs.
Thank you.
For diverse ACB communities by ACB communities. The 4 organizations hit the ground running in 2017. After setting up the organizational structures and building the teams, we began inviting members of the ACB communities to engage in the community needs assessment. Kim?
Okay, so the community needs assessment was actually the first task in our work plan. And the needs assessment kind of helped us guide the work with women. So we thought it was important to learn from the community by assessing the community's knowledge. So at that point, focus groups were conducted in the ACB community. And the main goal of the focus groups at that time was to identify what the community needs were with respect to preventing HIV, hepatitis C, and other STBBIs. It was also to assess community readiness and willingness to take action around the STBBIs and HIV and hepatitis C, and to understand the best way to engage and reach community members, and to inform the development of health promoting cultural specific and supportive interventions. So from the assessment, we learned that many ACB members never heard of hepatitis C and other STBBIs. So we were also advised to provide culturally relevant information about STBBIs. So the focus groups were a really powerful way to engage the community. It was an opportunity for us to kind of engage the seniors, which I know I did a lot of the focus groups, and an opportunity to engage the seniors, a population that is oftentimes left out of the conversation. We really connected with them and gained knowledge and wisdom by hearing their voices and stories. And they are considered like the griots in our African Nova Scotian community, in the ACB communities. So, so the results of the needs assessment guided our work into developing the Kitchen Table Talks curriculum and education series. It also guided our work around the youth drama. We trained women peer educators. We provided capacity building workshops for community-based organizations, and we shared information at 2 community forums. And all of this was in collaboration with the community-based organization Hepatitis Nova Scotia. And we educated the youth peer educators before they developed the youth educational videos, which we'll get into later on in the presentation. So from my perspective in doing the kitchen table talks, and I'm sure my team agrees, we identified the kitchen table talks as one of the best ways from the input we got from the needs assessment for us to connect with women in a positive and meaningful discussions. And we felt it was important for ACB women to have opportunities to basically stand in the truth in a safe space and to share important and life-saving information. So all these sessions were facilitated from a cultural lens for us and by us. Through these interventions, women and youth gain knowledge, understanding, and awareness of sexual health issues related to making healthy lifestyle choices and to prevent the infections such as HIV, hepatitis C, and other sexually transmitted bloodborne infections. So that's a little bit about the community needs assessments. And as you can see from the community needs assessments, we had 26 focus groups. If we can go back to that slide for a second. Yes, we had 26 focus groups that we did all together in the community needs assessment. We had 17 ACB organizations and communities in the HRM, which basically resulted in 280 individuals that were involved in the community needs assessment. 214 of those 280 individuals completed the needs assessment survey, and findings were summarized in the next 2 pages of the infograph. So that's a little bit about the community needs assessments. You guys, am I supposed to be talking about the community forums at this point as well? Okay, here we go. Okay. All right. So the community forums, this is a beautiful visual of the work that we've done in the community. So we attended several events providing information about the Nova Scotia Community Alliance project, and we disseminated information to the community about the prevention of HIV, hepatitis C, and other STBBIs. So we had an opportunity, the first opportunity to introduce the project to the community through the community engagement was we were at the Maritime Natural Hair and Beauty Show, and we had a great table with African cloth, as you can see, and we had treats and incentives with gift card draws, great conversation with folks of all ages connected to, hair and Black women in that particular forum we went to, and lots of surveys were distributed during this event. We also participated in the Dalhousie BIPOC community event, which was called Dreaming in Color, where we also had a display table. We had a game to test participants' knowledge of STBBIs. Again, we had treats, we gave us surveys, we had gift card draw. And the great thing about this community engagement event that we attended was that the event had musical performances as part of their event, which was a major attraction that helped us engage with the students. And the other event that we went to, which is demonstrated here, is we attended an African Heritage Month event. It was youth focused. It was put on by ACE, and it was a great turnout. And again, lots of community engagement, distribution of condoms at all of our community engagement opportunities and community forums, and just really educating people about HIV, hepatitis C, and STBBIs. And the community forums we did 2 community forums where we provided information updates on the project. One was held in Halifax, and the other, which is at the Halifax North Branch Library, and the other one was held at the Black Culture Center. And I think we did our best to have it in a location that served, the ACB communities in the HRM. So that's a little bit about our community needs assessment and our community forums.
Thank you, Kim. That was great. So we'll move on. So before saying anything about this, just want to go back again. I know several people have come in after we've started. What we're doing here is showcasing the project, which has been going on for the last 5 years. We've engaged with the ACB, African, Caribbean, and Black communities in Halifax Regional Municipality. And this tonight is a way of just sharing what we've done and showing what information we have gotten through this project with you. And many of you were a part of the project as well, but you know, there are many of you who are not. So that's what we're all about here. And I just want to say, whoever is in under the name of Kimberly Berry, please just put your real name in the chat so we know you're attending. And we'll go back to that at the very end. This is a final infographic that we put together from data acquired from our activities. And I'll just, you know, go through, I'm not going to go through all of this clearly, but on that right side, what we learned, you will see from the community forums, from the kitchen table talks, and youth engagement events, 77% of those surveyed showed an increase in their knowledge of these infections. And the knowledge of HIV, you can go back, Laura, I'm not there yet, knowledge of HIV, Hep C, and other STBBIs. If you look at the bottom of the infographic, 29% told us that they had changed at least one behavior. And this is, so what we did is we had interventions like the kitchen table talks, for instance. We had a survey, which we call a pre-post. So it would be administered after the intervention, but it would also cover knowledge that people had before the intervention, and we'd compare it to what they gained after the intervention. And then we would do a follow-up survey in about 3 months to see what else had changed. And so in the follow-up, 29% of people said they had changed at least one behavior. And of those, most of the change was just in how they talked about STBBIs. So next slide now, Laura, please. And this again just shows you nice, pretty colors of knowledge change. So one of the big things about this project is that the funders and we ourselves are really looking for change in knowledge. You engage community, you talk about these infections, you do presentations. So we're measuring because we have to evaluate what we're doing. And you can see there, I'm not going to go through the numbers, you can see that there was significant change in knowledge. People's knowledge, you know, a lot of people were poor, fair, good, and went up to good, very good, and excellent. And again, on the left side is a 31% increase from the pre-intervention sort of setting. Next slide, please. We will have an opportunity for questions and answers and comments later on. So throughout the life of the project, we've produced a lot of documents, and we're just going to showcase some of them here. This that you see here now is the slide from the opening of the kitchen table talks. Safer is Sexy is one of Randon's Facebook posts. And here's another one as well, and we'll go back to that one at the end. Just keep going, Laurie. And yeah, some more Facebook posts, and you'll see this is a midterm report document. This is one of the posters or flyers that youth developed in conjunction with their youth educational tools. And we had a forum where we talked about those tools. And here are what we condom cases, which we distributed when we had certain events. We gave out those cases, hold a condom and I think a lube, container of lube. And here's one of the opening slides for one of the youth educational tools, a PowerPoint presentation. And here's another one, and infographic. Just keep going, Laurie. Yeah. And this last part, this last one, let me just take a moment here. So one of the things that came up in our needs assessment, suggestions about how to engage community, and drama was one thing that came up. So we actually had a youth community drama group, mostly from and I'm blocking here, Tronis group. What community? Anyway, Democratic Republic of Congo, right? Yeah. Sam? Anyway, so they put on, we had a script done and we put on a drama. We don't have time to show you any of it tonight. It was called Shockwaves. But again, hopefully those things will be available for you to see even after the project is done. Okay, Laura, thanks. All right. Nice picture. Now it gives me great pleasure to introduce Sharon Davis Murdoch, CM. So Sharon is a social justice champion with a background, she's gone, she disappeared. Background in political science and public policy. Among her public policy accomplishments was the development of the first provincial guidelines for culturally competent primary health care in Canada. In December 2021, Sharon was named to the Order of Canada for her dedication in improving the health equity and inclusion of racialized communities in Nova Scotia. Sharon has received numerous awards and is a founding member and the co-president of the Health Association of African Canadians. In addition, she now serves as co-manager to the Association of Black Social Workers and Health Association of African Canadians COVID-19 Response and Impact Team. She is also an advisor to the Halifax Immigrant Partnership and secretary of the Dartmouth General Hospital Foundation Board. In October 2020, Sharon was selected as one of the Black women leaders for the Black Women in Leadership, Sharing and Shaping Our Journey online conference. We're pleased to welcome Sharon to present at this wrap-up event. Thank you, Sharon.
Well, thank you. Thank you. I am among many friends this evening, so I'm going to make myself comfortable and feel like I'm just hanging around with you and having a chat. I do believe that this is the second slide as opposed to the first slide of the presentation. Right. Okay. So I'm very happy, honored to be here with you this evening. And as Dr. David has said in his kind introduction, I am certainly here as a member of the whole community or communities, and with my direct connection to the Health Association of African Canadians, being a founding member. And I certainly would want to share with you that your work in this project dovetails with our broad vision, our mission, our mandate, and also our future. And that's what I hope to point out to you this evening. So as many people know, the vision for HAWK, we prefer HAWK as opposed to HACK for obvious reasons, is thriving healthy African Canadian communities in Nova Scotia. Our mission is to promote and improve the health of our people through community engagement, education, policy recommendations, partnerships, and research participation. And we apply all our work within the context of systemic cultural competence. And what I think I would like to add about that is that what we mean by cultural competence are is the awareness, the knowledge, the skills, and the policies needed to serve our people, to serve all people across their diversity. But with our particular focus in HAWK It is to serve our people, knowing that we are many, we are not one, we are heterogeneous, not homogeneous. And so there are many populations, but all deserve to be served within a culturally competent health system. Next slide. So indeed, your work is our work and our work is your work. And that's the point that I'm going to make throughout this. And so the ABCs of our health priorities as people of African ancestry, the ACB communities, as you so nicely put it, our health priorities include establishing race, ethnicity, and language information and statistical data to inform our decision-making and to fund our programs and services equitably. And I did say equitably, not equally. Equity is about justice and fairness. Equality very often means exactly the same. We don't want a health system that serves us in exactly the same way as it serves other populations who may be more privileged than we are, maybe marginalized, but in different ways. We are looking for just, fair, and just equitable access and equitable delivery. So programs and services that are funded equitably. We also, as a broad people across all of our diversity, understand that racism is a social and structural determinant of health. And within the Canadian health context, we want to build that cultural competence I spoke about at an interpersonal level, that is between you and your provider, between you and whoever that provider is. Within the health system, there are many providers. You think quite often of doctors and nurses. Let's think much more broadly. Let's think about social workers. Let's think about coaches. Let's think about occupational therapists. Let's think about dentists. All of these people, the interaction between the patient or the client and that clinician, we want to have that interaction be just and fair and culturally competent. And we want the services that serve our people to be the same way. We want, at a system level, to have a system that responds to our needs equitably in culturally specific ways, as you have mentioned and Kim mentioned in her remarks earlier. Culturally specific applications are toward the building of cultural competence. And indeed, last but not by no means least, we want to build Black health infrastructure in this province and in this country to ensure that we, all of us across our diversity, are in leadership positions at every system, at every level of the health system, and in all settings, including the criminal justice system. So those are our ABCs, and we together are going to speak to them, are going to see them realized. Next slide, please. So I wanted to point out to you how, in very specific ways, your project demonstrates Black leadership in health. Indeed, what have you done? You have done many, many things. You have provided statistics to the system. You have provided outreach through focus groups. You have made it about us, by us. You have outreach to many different communities, understanding that we are not all the same. We are heterogeneous. You've understood that. You've talked to youth. You've engaged prison populations. You have influenced policy. You have built capacity across the system within those people who use the system, as well as those people who serve as clinicians and administrators and providers of service in all ways. You have built knowledge and shared it. You have created public education, and I am so delighted to hear that in fact you can say, as few can say at the end of a project, that you have actually changed the behavior of people to improve their health. So you have done remarkable things in this project, and you are at the end of your project, but I want to show you that you are in fact informing all of the work that I described earlier, and indeed in these specific ways you are informing. You know that quite a few years ago, actually, we collaborated on an African Nova Scotian health strategy. Nova Scotia Health has not yet released that strategy, nor released their intention to implement that strategy, but many, many people were involved in informing that strategy. And so we want to see it, we want that it will see the light of day, and that Nova Scotia Health will commit to responding to the recommendations of that. But in fact, your work has informed throughout the life of your project, has informed that African Nova Scotian health strategy. You have actually, through your work, made those recommendations. And you know, when you finally see the strategy and the recommendations, you will see how directly you have influenced and informed that strategy. Indeed, Hawk and I have personally been involved in the birth of the Nova Scotia Brotherhood Initiative in this province. And the expansion of the Nova Scotia Brotherhood Initiative and the introduction, everybody hold your breath, because we do hope that this very spring, we will see the full funding of a Nova Scotia Sisterhood, the introduction of a Nova Scotia Sisterhood Initiative, which is the primary healthcare equivalent of the Nova Scotia Brotherhood Initiative. And we have been advocating for this for many years. But what I want to say to you is that your work in your project will have informed many things in the way that the Sisterhood Initiative will be structured and the kinds of issues that it will speak to. And Kim's work with Black women in this province, informing them and hearing their voices and having them as participants, is key to what we hope will be the delivery of this unique in Canada primary healthcare model for us women, by us women, about us women. And as well, in this province, unlike any other province in Canada, we are now beginning to reap the benefits of 22 years of advocacy for the collection of race and health data with race, race, ethnicity, and language identifiers. We are engaging communities across this province, and we are talking to them about what they want to see as the way that we collect the data, but also how that data is interpreted, how that data is to be used, how it is used for our good, not against us. And indeed, it is a very important thing that you, through your project, have created and provided some of the first statistics that give us a real understanding of the inequities that are facing our people. That is astounding statistic that a quarter of the Black population of this country has HIV, while we only make up 3% of the population. That comes from you. That comes from your work. And so your work in creating our understanding and knowledge about where we stand, what our health outcomes are, what our health outcomes are likely to be given our situation, given our vulnerability, if you like, to STBBIs and so on. Very important work that informs this groundbreaking policy development, first in Nova Scotia, first in Canada. Next slide, please. So I think I've made the point, I hope I've made it, that your work endures. The Nova Scotia Community Alliance has increased knowledge, it has provided data, it has changed practice. And together we can build action on Black health infrastructure, action around data, action on systemic cultural competence at a national level. And indeed, through your engagement of many people at many levels, you have increased and demonstrated representation of our people at the highest levels of the health system, including health administration. So bravo to you. And finally, the next slide, I want to thank you so sincerely for your hard work. And I want to tell you that your work and your commitment is just the beginning. The future is not going to be without you. The future is going to be with you at every step. And I look forward to it. And I thank you for your attention. Thank you.
Thank you so much for that, Sharon. That was great. Really, uplifting, especially for us when you're at the end of this project. You always kind of feel, so it's that, yeah, that was good. That was really good. Because one of the things for us, it's interesting when you undertake a project and you're in the middle of the project, you sometimes do not recognize what you have done and the impact you've had until you look back. So this evening is a look back time for all of us as well. So that was great. Okay, all right, we're going to move on then to another aspect of things. So just want to tell you a little bit about this next piece that we're going to share. We had teams of youth, what we call youth peer educators, who we gave the challenge of developing educational tools for youth. And we didn't, try to tell them what to do or what direction to take. We left it up to them to come up with things that they felt would be impactful for their peers in terms of, learning about STBBIs, HIV and other STBBIs. And so we're going to show you just 2 short videos as examples of one of the educational tools. And then after that, we're going to have a little fun. We're going to see how much you know about STBBIs. So, yeah, we hope you'll take part in that. Next slide, please. Yeah. So here are the teams. With 2 teams in the end of 4 youth each. And I don't know if you remember me introducing Micah Smith. She was the peer educator coordinator for the youth. And those are the names of the teams. Donna was the leader of team 1, and Katiana or Kate and Vanessa V were the 2 leaders for the second team. And they developed, so the first team actually developed 2 PowerPoint presentations. We kind of showed you the first slides on those. The second team developed these videos And we're going to show them to you now, and then we'll have a little bit of a question time for you.
Hi, welcome to a video series detailing all you need to know about sexually transmitted bloodborne infections, or STBBIs. What is a STBBI? STBBI stands for Sexually Transmitted Bloodborne Infection. STBBIs are a group of infections, either viral or bacterial, transmitted by exposure to infected blood and/or bodily fluids through sex. Herpes simplex virus, HSV, syphilis, chlamydia, gonorrhea, HIV, human papillomavirus, HPV, and hepatitis B and C viruses are all types of STBBIs. How does someone get a STBBI? STBBIs can be transmitted via sexual contact, either vaginal, oral, or anal sex. STBBIs can also be spread through the use of drug, medical, or tattoo equipment, such as needles, that were previously used by a person with a STBBI. Transmission occurs when there is contact between infected blood and/or bodily fluids. What are the common signs and symptoms of the STBBI? Oftentimes, there are no symptoms or signs, but the symptoms and signs can vary depending on the infection and the site of the infection. This can range from localized signs in one area or generalized signs through all over the body. How is it tested? A swab is collected from the localized area of infection, and a blood test is taken. Are STBBIs curable? As I remember from previous slides, STBBIs can be either bacterial or viral in nature. Bacterial infections are curable, but may cause long-lasting damage before treatment. Viral infections are usually incurable, with some exceptions that we will detail in later videos, but can be controlled with treatment. How do you prevent STBBIs? Abstinence from any type of sex, and mutual monogamy with a partner who has tested negative. Now let's take a more detailed look at the different types of STBBIs. Remember, knowledge is power.
Hello, my name is Angel, and this episode of the Sexually Transmitted Bloodborne Infection series will cover chlamydia. After this video, you should be able to answer the following questions about chlamydia. What is chlamydia, and what does it do? How do you get it? What are the common signs and symptoms? How is it tested for? Is there a cure? And how is it prevented? Starting off with the first question, what is chlamydia and what does it do? Chlamydia is a bacterial infection that is transmitted through sex. It is most common through ages 14 to 24, and the majority of those that are infected do not get symptoms. If left untreated, chlamydia can cause various complications, including chronic pelvic pain and infertility. The next question is, how do you get chlamydia? Chlamydia is transmitted through unprotected oral, vaginal, or anal sex. Penetration does not need to occur to become infected. Genital contact with secretions of an infected person can infect you as well. The next question is, what are the signs and symptoms of chlamydia? The majority of men and women do not have symptoms from chlamydia, and symptoms aren't usually noticed until several weeks after being infected. Symptoms for women include abnormal vaginal discharge, painful urination, painful sex, and abnormal vaginal bleeding. Symptoms for men include clear or cloudy penile discharge, painful urination, and swelling or pain of the testes. The next question is, how do individuals get tested for chlamydia? Chlamydia can easily be tested for by swabbing the throat and/or genitals or by testing urine. The area of the body that is most likely to be infected is tested. Results should be available within 7 to 10 days. The following question is there a cure for chlamydia? Chlamydia can quickly and easily be cured by antibiotics. After a positive test, a doctor can provide a prescription. If you have a partner that has already tested positive, you may start treatment before a positive result. The treatment is often one pill. The next question is, how can chlamydia be prevented? Chlamydia can be prevented by practicing safer sex and using a condom with sexual partners, getting tested for sexually transmitted and bloodborne infections regularly, and asking partners if they have been tested recently. Abstinence is also an extremely safe and adequate preventative measure. Thank you for watching and listening to my educational video on chlamydia. Production of this video has been made possible through a financial contribution from the Public Health Agency of Canada.
So we're just going to go straight into the polls. We really appreciate the work of the youth peer educators. So here's the first poll. First question, STBBI. We know it stands for sexually transmitted and bloodborne infection. Which of the following counts as an STBBI? And you can choose more than one answer here. So go ahead, you have a few seconds maybe to answer those questions. As many of you as can, please. Let's just see what your knowledge is.
I don't know if anybody else saw what was on their screen, but what came up on my screen was the results. Not
sorry, did you relaunch it, Kimberly? You probably should stop it and then start again, relaunch.
Yes, okay.
Okay, so the key here is, and again, that was gone through in the first video, is that there's one condition here, cellulitis, which is not a sexually transmitted or bloodborne infection. The others are. So cellulitis is the one that's not correct. Okay, let's go to the next question, please. And again, these are totally anonymous. We don't know who is answering what. So not to worry, we're not going to know who has put in what answer. So here's one. When is it important to get tested for STBBIs? Again, just go ahead. You can choose more than one answer. Okay, so you can see the results and how many of you choose all of the above. And yes, when you have symptoms in terms of pregnancy, that's always recommended. And again, if you're going to have a new partner. So that's good. I think we have one more. Kimberly? Yeah, and this one is, which of these activities listed is high risk for transmitting an STBBI? So which ones, and again, more than one, you can select more than one. Which of these do you think is really high risk for getting an STBBI? Either getting or passing it on. Okay, so again, most people choose that second choice. The key here is that if someone has a sex toy that's been contaminated with body fluids, been in contact with body fluids, that's also a high risk of passing on infection, as well as having vaginal or anal sex without a condom. The other ones would not be considered high risk. All right, thank you so much for taking part in that. We're going to keep moving. And again, we thank the youth. These videos, once they're polished and ready and finished, the intent is to put them on a YouTube channel. Likely they'll go on the Hawk YouTube channel where people can see them on an ongoing basis. All right.
We would like to share a message from the Honorable Wanda Thomas Bernard. Although she was unable to attend the event this evening, she took the time to record a message for us to share with you. Just a little bit about Senator Wanda Thomas Bernard. She's an African Nova Scotian woman who has been appointed to the Senate of Canada, representing the province of Nova Scotia and her hometown of East Preston. Senator Bernard champions issues impacting African Canadians and people living with disabilities. She is particularly interested or invested in human rights, employment equity, and mental health. Through her involvement in community projects, her social work career, her time with Dalhousie School of Social Work, and now her work in the Senate, Senator Bernard has maintained a deep dedication to social justice and racial justice. Senator Bernard advocates for reparation for the historic and continued anti-Black racism impacting the lives of African Canadians in her work.
Good evening. I'm Wanda Thomas Bernard, Senator from Nova Scotia. I join you today from my home in East Preston, Nova Scotia, land of Mi'kmaq, unceded territory. It truly is a pleasure to join you at this closing event for the project Engaging African, Caribbean, and Black Communities in Nova Scotia in prevention of HIV, hepatitis C, and other STBBIs. This is such an important work that was funded by the Public Health Agency of Canada. As a member of the original team that began with a vision for what could be with this project, I am incredibly proud of the work that you have all managed to accomplish over these last number of years. It truly has been a really strong collaboration amongst community groups that are deeply, deeply committed to addressing these issues. I would say that one of the things that I'm most proud of is the fact that you have created space and opportunity for people to engage in very meaningful conversations, very significant messages about the prevention of STBBIs. We were not having these conversations when this project idea came to mind. And so seeing what you've done with it makes me realize that although we're wrapping up this particular project, the work is very much unfinished. We must continue to break the silence. We must continue to have these very difficult conversations. And most importantly, we must continue to educate and create awareness so that we help to create a better future for all of our community.
Well, that was a very nice little piece, giving us great praise and encouragement for the work that we've done.
I thank you all for your work, for your contributions to the success of this project. A job well done. Congratulations. Good evening.
All right, that was really good, Lori. Thank you for that too. So just to step back a little bit, because as Lori told you, in 2016, when the opportunity came up to do this project, there is a group that got together and said, you know, this is something that's a key project. We, you know, when we talk about HIV, and we have done this before, a lot of people run the other way because there's so much stigma and, you know, lots of things attached to these things. But we felt that as Senator Thomas Bernard said, we need to break the silence. And so this project was put together and implemented. And we're still very conscious that we have not done everything that we really set out to do. We have done, you know, as we look back, significant things. COVID came along in 2020, COVID-19, and put a huge dent in our person-to-person activities and the project. But nevertheless, we're finishing on a strong note. And I'm not sure if you realize this, but you're part of this project now. All of you here who are attending this event have also been engaged with our project. And you know, we played those snippets of videos, we've told you different things. We would like you to be ambassadors as well. We certainly would have liked to have continued a similar project for another 5 years, 3 to 5 years. But those of us now who are involved in the implementation of this project felt that we could not carry on anymore, and nobody picked up and decided, hey, they'll step up to do it. But maybe in the future, somebody will. But in the meantime, please, please keep it going. You know, there's so much need for this type of dialogue, and not just for STBBIs, but for other things as well in our Black communities. And Sharon spoke to that very eloquently. So we're wrapping up March 31st. There's a final report that's going to be put into the Public Health Agency of Canada. What we're going to do is to have a subdomain on the HARC website, and they've, you know, very kindly agreed to that. And we'll deposit material that we've developed on this project there, so that in the future anyone can go looking and find material if they want to do something like-minded. The videos were, as I said, we'll put them on YouTube so that anybody can go and watch them as well. So again, we would urge you to, you know, to keep going. We're winding down this particular project, but who knows what will come in the future. So again, just wanted to put that out there. Laurie, if you want to go to the next slide, please. So we're going to just, in the next couple of slides, thank some of the individuals, some of the organizations who have been engaged with our project, many of them from the very beginning. And again, I'm not going to read through those names. You can scan them very quickly. They include individuals who have worked with Adam, who've worked with ABSW, who, you know, with a previous project coordinator. We have individuals who worked with HARC. And so again, we just applaud them. And we just want to say that there are many, many people that have contributed to the success of this project. So we're not going to take all the credit because, you know, we've all worked together. We've all worked together. And we just are so thankful for everyone who worked with us and who is still working with us today. And here are some of the organizations. Again, not an exhaustive list, but you know, just to kind of let you know, there are two that are, the HEPNS was one of the organizations that also helped us with training of youth, and the Black Cultural Center also was very engaged with the project as well. And again, you see the names. I'm not going to read them off, but again, we just are so thankful for the work that they have done with us. And there have been groups. And again, Laura, if you want to just show those, you can just put them all up. Yeah. Yeah. So again, we've done, as you've heard, different activities, and there are groups that contributed to those activities. So again, we just wanted to acknowledge and to say thanks to them as well. And then we had capacity building workshops. We haven't really said much about these workshops, but the intent is to help organizations who are either actually working with the ACB community or potentially working with the ACB community to give them some tools that will help them as they encounter individuals from the ACB community in their work. And so we had these workshops. We've had several of them, and these are groups that have attended those workshops. And we're still going to have a few more, I think, before we're done. And you can see the names there again. We're not going to go through all of those. And then we want to thank the Public Health Agency of Canada. Again, I don't have all the names of all the individuals who worked with us throughout the life of this project, but we've had managers, we've had program officers, project officers, and of course, FACT provided the funding. So again, we're very grateful for that. And, you know, as I said, this project itself is finished, but who knows for the future. All right. Now, does anyone have any questions or comments that they would like to make? Either speak it out or you can put somebody in the chat. And so, anybody? Okay. So we're going to move on then. And if you have anything, so until March 31st, we're still reachable at the email of info@nsca.ca. So if you want to send us a message, ask a question, you can reach out to us that way. Now, let me just say again, there are several people who came in. We sent out a link in error, and many of you have come in under the name of Kimberly Berry. We're going to have a draw for door prizes. There's no door that you came in through, of course, a virtual door, so to speak. But we need your names for the draw. So please, if you haven't done so already, and you notice Kimberly Berry is on your screen as you, just put your real name in the chat so that we will have it for the draw. We're going to do the draw after. We'll do it tomorrow. And we have 4 door prizes, and there's going to be a surprise. There are good prizes, though, substantial prizes. And it's just for 4 people who are fortunate. Thank you for coming. But really and truly, all of you, we thank all of you for coming. And, you know, you have some time to put your name in the chat, please, if you came in under Kimberly Berry. So this is the end of the evening, unless anybody else from the steering committee or otherwise has anything they would like to say. But again, thank you all for being here with us.
I wanted to quickly say something.
Who is that? Go ahead. Yeah, go ahead.
Random.
Please. Yeah, Random.
I just wanted to say that I really appreciate the opportunity that you guys gave me to work on this project and the responsibilities that you entrusted me with. And it was great working and getting to know all of you. And I'm sad to see it come to an end. And I hope it's not actually the end. And I hope to work with all of you in the future. That's all I would say. So thanks so
Thank
much.
you for that, Randon. Thank you. And as I said before, really appreciated your work with us too. Anybody else?
Thank you, Brandon.
Hi. Yeah, so my name is John. Hello.
Yes, yes.
Oh, sorry. Yeah.
Go
So
ahead.
I asked a question. I placed my question in
the chat.
Yeah.
Okay, I did not see the question. Do you want to ask it out loud? Did you put your real name in the chat?
Yes, I did.
Okay.
It's about HIV. Yeah, basically I wanted to know about the cure, about the HIV cure.
About the cure for HIV.
Yeah,
You're talking about what you heard in the news the other day?
Yes, I think it's related to stem cell.
Yes, stem cell transplant. So many years ago, I've forgotten how many years ago, I'll just take a moment to answer your question. There was it wasn't a real sort of plan as such. There was somebody with HIV who needed a stem cell transplant. And in their wisdom, the team that chose the matching donor chose someone whose cells had a genetic resistance to HIV. So when they gave those white blood cells to that person, because the way transplant works is the donor white blood cells take over your body and they become your own white blood cells. So HIV no longer had a place to hide, couldn't get into those cells, and that person was cured. And that was done again recently. So it's not a mainstream thing because there are particular conditions that need transplant. So, but it's something that certainly people are going to look at more and more.
Okay.
That's a short answer to that.
Okay, thank you.
All righty. You're welcome. I hope that helps.
Yeah.
All right. And Laurie, let's go. One more. So we want you to, before you go, look at this and remember. Remember what? Remember, talk, test, treat. 3 T's for everyone to remember and prevent the spread of STBBIs. I sound like I'm doing this alone. Am I doing it alone?
Talk, test, treat.
Talk, test, treat.
Talk, test, treat.
Yes, remember the 3 T's, talk, test, treat. Talk to your significant others or your family members or your friends. Just make this a part of your conversation. Let's just make, we're sexual beings, right? And these infections affect many people in our communities. So let's talk about them. Get tested. When you get tested and you know that you're infected or somebody finds out they're infected, then they can be treated. And there's treatment for all of them. Some of them are not cured, but there's treatment for every single one. Thank you, everybody, and you enjoy the rest of your evening.
Thank you.
And just much blessings to everyone.
All right.
Thank you.
All right. Thank you, everyone.
Thank you, everyone.
Thank you. Thank you.
Thank you. Thanks, everyone. And thank you, Dr. David and Lori, particularly.
You're welcome, Sharon. Thank you.
Yes, thank you both.
All right. That sounds like
Thank you.
Hardo. Lori, can you stop sharing, please?
I can.
Thank you.
Thank you.
I just want to see the faces.
But I can't see the faces. Nobody's got their cameras on.
Yeah.
Oh.
You okay, everybody? Thank you. Hey, Robina, thank you for coming.
All right. Take care, everyone.
All right. Y'all take care.
Stay safe.
Bye.
Bye.
All righty. Bye-bye now. I mean, you're welcome to hang out with us for the rest of the night if you want, but You may not enjoy it as much.
Hola.
The team is going to hang in there a little bit.
Mhm.
Please, team.
Brandon staying?
He's
Hey,
there.
Lakon.
Brandon stay.
I see Brandon.
Yeah,
Just
he's there. I'm going to stop the recording.